We would like to express our gratitude to our sponsor, First Cup Coffee, the original seed, for making this video possible. Shop firstcupcoffeeusa.com. First Cup Coffee, the original seed, is dedicated to providing high-quality coffee that fuels your studies and work with a rich and invigorating taste. We appreciate their support in bringing you valuable, free educational content. Remember to visit firstcupcoffeeusa.com for your daily dose of exceptional coffee. They also provide catering services for events and have a selection of fashionable clothing items for sale. Message them on Instagram at CoffeeFirstCup to receive generous discount codes. Introduction. Alkylating agents represent a significant class of chemotherapeutic compounds utilized in the treatment of various malignancies. Characterized by their structural motifs containing bis, chloroethyl, amine, ethyleniamine, or nitrosourea moieties, these agents are classified into 6 distinct groups, each with specific clinical utility. Noteworthy among the bis, chloroethyl, amines are cyclophosphamide, mechlorethamine, melphalan, and chlorambucil, while ifosfamide exhibits a closely related spectrum of activity with distinct toxicity profiles. Thiotepa and busulfan find application in breast and ovarian cancer and chronic myeloid leukemia, respectively. The nitrosoureas, carmustine, BCNU, and lomustine, CCNU, showcase efficacy in brain cancers and hematologic malignancies, whereas the tetrahydroisoquinolines lurbinectidine and trabectedin emerge as novel additions to the armamentarium, each with unique indications. Alkylating agents. The major clinically useful alkylating agents have a structure containing a bis, chloroethyl, amine, ethyleniamine, or nitrosourea moiety, and they are classified in 6 different groups. Among the bis, chloroethyl, amines, cyclophosphamide, mechlorethamine, melphalan, and chlorambucil are the most useful. Ifosfamide is closely related to cyclophosphamide but has a somewhat different spectrum of activity and toxicity. Thiotepa and busulfan are used to treat breast and ovarian cancer and chronic myeloid leukemia, respectively. The major nitrosoureas are carmustine, BCNU, and lomustine, CCNU, and they have activity in brain cancers and hematologic malignancies. The tetrahydroisoquinolines lurbinectidine and trabectedin are the newest class of alkylating agents. Lurbinectidine is approved for the treatment of metastatic small cell lung cancer, while trabectedin is approved for unresectable or metastatic liposarcoma or leiomyosarcoma. Mechanism of action. As a class, the alkylating agents exert their cytotoxic effects via transfer of their alkyl groups to various cellular constituents. Alkylation of DNA within the nucleus probably represents the major interaction leading to cell death. However, these drugs react chemically with sulfhydryl, amino, hydroxyl, carboxyl, and phosphate groups of other cellular nucleophiles as well. The general mechanism of action of these drugs involves intramolecular cyclization to form an ethyleniammonium ion that may directly or through formation of a carbonium ion transfer an alkyl group to a cellular constituent. In addition to alkylation, a secondary mechanism that occurs with nitrosoureas involves carbamylation of lysine residues of proteins through formation of isocyanates. The major site of alkylation within DNA is the N7 position of guanine. However, other sites are also alkylated, albeit to lesser degrees, including N1 and N3 of adenine, N3 of cytosine, and O6 of guanine. These interactions can occur on a single strand or on both strands of DNA through cross-linking, as most major alkylating agents are bifunctional, with 2 reactive groups. Alkylation of guanine can result in miscoating through abnormal base pairing with thymine or in depurination by excision of guanine residues. The latter effect leads to DNA strand breakage through scission of the sugar phosphate backbone of DNA. Cross-linking of DNA appears to play a key role in the cytotoxic action of alkylating agents, and replicating cells are most susceptible to these drugs. Although alkylating agents are not cell cycle specific, cancer cells are most susceptible to this class of drugs in late G1 and S phases of the cell cycle. Resistance. The mechanism of acquired resistance to alkylating agents may involve increased capability to repair DNA lesions through increased expression and activity of DNA repair enzymes, decreased cellular transport of the alkylating drug, and increased expression or activity of glutathione and glutathione-associated proteins, which are needed to conjugate the alkylating agent, or increased glutathione S-transferase activity, which catalyzes the conjugation. Adverse effects. The toxicities associated with alkylating agents are generally dose-related and occur primarily in rapidly growing tissues such as bone marrow, myelosuppression, gastrointestinal tract, diarrhea, mucositis, and reproductive system, infertility, sterility, and loss of menses. Nausea and vomiting can also be a serious issue with a number of these agents. In addition, they are potent vesicants and can damage tissues at the site of administration as well as produce systemic toxicity. Alkylating agents are carcinogenic in nature, and there is an increased risk of secondary malignancies, specifically acute myelogenous leukemia, AML. Cyclophosphamide is one of the most widely used alkylating agents. One significant advantage of this compound relates to its high oral bioavailability. As a result, it can be administered via the oral and intravenous routes with equal clinical efficacy. It is inactive in its parent form and must be activated to cytotoxic metabolites by liver microsomal enzymes. The cytochrome P450 mixed function oxidase system converts cyclophosphamide to 4-hydroxycyclophosphamide, which is in equilibrium with aldophosphamide. These active metabolites are delivered to both tumor and normal tissue, where non-enzymatic cleavage of aldophosphamide to the cytotoxic forms, phosphoramide mustard and acrolein, occurs. The liver appears to be protected through the enzymatic formation of the inactive metabolites for ketocyclophosphamide and carboxyphosphamide. Conclusion. Alkylating agents exert their cytotoxic effects primarily via alkylation of various cellular constituents, with DNA serving as a major target within the nucleus. This alkylation process disrupts DNA integrity, triggering mechanisms leading to cell death. While alkylating agents are not cell cycle specific, they exhibit heightened efficacy against replicating cells, particularly in late G1 and S phases. However, the emergence of acquired resistance poses a significant challenge, often mediated through augmented DNA repair mechanisms or altered drug transport and metabolism. Despite their therapeutic efficacy, alkylating agents are fraught with dose-related toxicities, predominantly affecting rapidly proliferating tissues such as bone marrow, gastrointestinal tract, and reproductive organs. Nausea, vomiting, myelosuppression, and infertility constitute common adverse effects, underscored by the potential for long-term carcinogenicity, including an increased risk of secondary malignancies such as acute myelogenous leukemia, AML. Cyclophosphamide, among the most widely utilized alkylating agents, offers the advantage of high oral bioavailability, facilitating both oral and intravenous administration with comparable efficacy. Its activation by liver microsomal enzymes yields cytotoxic metabolites, ensuring broad delivery to tumor and normal tissues alike while minimizing hepatic toxicity through enzymatic inactivation. Thus, amidst their considerable therapeutic potential, alkylating agents remain pivotal components in the armamentarium against cancer, albeit accompanied by notable challenges and careful management of associated toxicities. Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you hear or see in this video.